네. 뭐,
Sudhir, shall we start? Right. Without wasting that much of good evening, everyone, shall we start? As usual, there are many in the registered list, but people are reluctant to come for the live exam, live lectures, as they think that we are going to ask questions and that's not that kind of thing that we are not going to make you uncomfortable or anything. We just ask questions sometimes for the continuation. I'm not going to ask any questions today. What we are going to do as introductory lecture, and what we are going to do is just to give you a brief idea uh, about the exam and what we are going to do for this OSCE exam, and what we are not going to do, what we are going to do, and what are the things which are included in our OSCE uh, lecture series. So that kind of brief, and we are going to do two uh, cases, two OSCE type questions today, and we are going to finish this within 1 hour. We are not going to waste your time that much, as we are trying to give you uh, the most important things which you must learn to get through the forensic exam. That is what our primary target. As we this is not a major subject, you have to consider mainly concentrate to the major subjects. But this subject, however, this subject become a subject which become a rate limiting factor where the MCQ and the OSCE MCQ will become the rate limiting factor where we are going to pass the exam or not by this subject. So anyway, this is more important, and what we are going to uh, give you for the OSCE is if you we are going to give the best uh, way to complete this OSCE, and you are going to get full marks from that OSCE to OSCEs. So because of that, even though you are not giving good answers in major subject, these two uh, questions you are going to get full marks. That's how we develop this, so when it can compensate whatever the deficit from whatever the other subject as well, right? So we can, if you want anything, you can ask from Sudhira. If you all later or whatever the convenient time, you can ask about what are our statistics. We passed last exam, we have 85% of pass percentage of the MCQ exam, and who the people who went through our OSCE has the 100% pass rate, where almost all the people who came to our OSCE session who got through the exam, right? So, and little bit, as Sudhir asked me to add about myself. I'm Dr. Janaka Polonwala. I'm an acting consultant in forensic medicine in Ministry of Health, Sri Lanka. So that's easy for us to give you and to predict the correct, exact type of exam questions where you are going to get this time, you are going to get this, as I am a person who also learn from those examiners who are preparing your lectures, your exam questions. So we have the same type of thinking, similar thinking pattern. That's why we are predicting so much correctly in this subjects. That's why our that is there's no not that much of magic in this. That is why we have a kind of highest percentage of passing when somebody is going through our lecture series, and the Sudhir and their team developed this into a short learning videos. Those learning videos are just kind of short time videos, so that is not so called boring, lengthy, ordinary lectures. Those are modern type short videos. You can learn those things in between your major subjects, right? So that is what the things for that, and we are going to cover almost all the OSCE related theory and OSCE related almost all type of different type of questions. So when we already uploaded 75 questions, and we are doing few more questions. Today we are going to do two, and next week we are going to do another few questions, where today we are going to do few related modern type of questions, and we are going to next week we are going to do those questions which are related to those these days what has happened in the recent past in Sri Lanka, where there are cyclone, there are landslides, there are missing people, and there are some kind of mass disaster management. So those things we are going to discuss in next week onwards till the OSCE exam. So that is what our plan, and already we have uploaded 75 questions. All those 75 questions cover your almost all the type of questions they are going to ask in your exam. So if somebody is going through those 75 questions, you can find out a pattern. We introduce you a pattern where you are going to answer the examiners in that pattern. So that pattern follow gives you a standard pass mark, uh, kind of marks which are uh, well beyond your pass score. So because of that, you can get uh, both stations, both questions you are going to pass by following this uh, the uploaded package, including those 75 questions. So because of that, that is why the last time we have a 100% passing rate for this OSCE, right? Okay, let's move into these questions. If anyone has questions, you can ask. those questions. I'm not going to ask questions, and what we are going to do is we are going to ask questions in future where the people who are following our setup, we are giving separate time, as we are going to give you 2 minutes and we are going to give you 5 minutes to discuss the question. That is not today, that is individually, without you don't you're maintaining your privacy. No one can listen to that. Individually we are going to give some anyone uh, to as exactly as two questions, and going to ask them individually where those people who are following us in the future, right? So that is what our plan, to give you the maximum. So we are not going to do any uh, kind of repeated questioning or asking your questions. So that is in this OSCE setup, we are not doing that. We are doing it just in, sometimes we are doing it in MCQ. Just we ask questions. That is not for to make you uncomfortable or anything. Uh, Anything to make you uncomfortable. Just ask questions, and no one can remember those things. Whoever give the answer, whoever did not give the answer. So that is not that much of issue. Don't worry. And that is why when we are asking questions, there are many in the registered list and people who are not coming to the live sessions, and they later go to the lectures and they later send those messages. So what is this, what is this, this one, what is this? So that is what the messages comes in few days after, because people are going behind the record version rather than coming for the live version. So that is, don't worry, don't get upset, don't get panic, don't become that kind of uncomfortable. So that is not, we are not trying to make you uncomfortable. We just ask questions. So anybody, the people who are here, you can ask questions as if you want to ask anything, right? Okay, I'm going to read this. If anyone want to know anything, you can ask, right? Okay. Hmm. You are an MO doing your shift at an ICU. A high profile politician. Can you all see the screen?
Yes, sir.
Okay, right. Uh, you are an MO doing your shift at an ICU. A high profile politician was transferred to your ICU from the prison hospital for further management. On examination, GCS 15 out of 15, blood pressure 170 by 110, past medical history include ischemic heart disease and diabetes mellitus. Your consultant informed you to do the basic investigations and keep him under close monitoring. Describe your medical legal management precisely. Right, we'll read the all four sub questions and we'll come to the no, we'll discuss this first, right? If anybody willing to answer, we are more than welcome you, right? But I'm not going to target anybody and ask. If anybody want to ask, answer, you can freely answer. No one going to judge you. No one going to think that this person gave a wrong answer. So don't worry. Even we also can't remember who the person gave the answer, right? When you are going to the next question, you can't remember, right? Okay, describe your medical legal management. So this is the type of question you are going to get. Don't expect they are going to give you an easy question like what is rigor mortis, right? What is, how you are going to confirm the death? So that kind of questions, those are ordinary basic questions. They are not going to ask. This is modern forensic. Even though the forensic things are basic science and things are included, but there are some things which are related to the modern day-to-day practice. What are the things they are going to ask? They are going to ask these things, not those ordinary, how we are going to diagnose the death, how, what is rigor mortis, what is putrefaction. You never going to get that kind of question. As what has happened to the people is they are following the all those ordinary theories and ordinary lectures, and they are going behind those things, and and you think that you are correctly understood everything, but when you are going to the exam, you are getting this kind of practical question and you don't have any answer. That is what happened in forensic. That is why, because of the forensic, almost more than half of the people who got uh, fail because of you don't know the modern type of develop altered type of this modern type of forensic, right? Rather than saying any other word, it is modern type of practical forensic application. You don't know that's what happened, right? Okay. So what is describe your medical legal management precisely? Medical legal management. Anybody? I'll give you few seconds. If anyone willing to answer, you can answer. If not, I'm going to tell. Chamath, do you like to answer?
I would like to answer, sir, but the thing is, I'm still trying to understand what they're trying to want us to tell
Okay.
about medical legal management.
Yes. As you know, when it comes to the patient management, you have different type of management. What are those? Clinical management, medical legal management, right? There are the investigational type of management and things, but simply you can divide it into clinical management and medical legal management. So when it comes to no one is going to ask you the ICU care, clinical management in forensic OSCE, right? Chamath, that is, no one may, if you are giving an answer that I am going to give atorvastatin and antihypertensive drugs and things, that is not related to forensic. That is related to clinical management. That will ask in your medicine, pediatric surgery, and genomes lectures, OSCE stations, right? So when it comes to the forensic, they are asking the medical legal management. If you are giving answers like I'm going to give antihypertensive drugs, so that is you are not getting any mark, right? So what is your medical legal management? What do you think? If I ask what is your management, everybody will answer that how you are going to do this one, clinical. But it is when it comes to it should be medical legal management. So I'm going to give you the answer. So you should answer. You have to have a kind of this kind of the one, two, three, four, that kind of answer you should give without hesitation. So then they know that you are in a state of mind that you are practical person who is okay for become a doctor, intern, then post intern, whatever. Why? When it come to courts, the legal system, Sri Lankan legal system is accept a doctor as a medical legal expert. So you can't say I'm a intern, I don't know. You can't say that. I'm a post intern in OPD, I don't know about medical legal things. You can't tell that because you are a medical legal expert according to the law, right? So I am going to give the answer. So this person, so when it comes to medical legal management, consent is a first medical legal issue, right? You can say, as this person is a politician, so uh, he's a GCS. His GCS is 15 out of 15, so he's a competent adult. So consent is not consent is a first medical legal issue, but I can get the consent for whatever the procedures, whatever the investigation from the person as his GCS is 15 out of 15. So that is first. Then I'm going to document everything properly in the bedhead ticket, as the bedhead ticket is a medical legal document which can be ended up in the courts. So including proper documentation, date, time, place of examination, and my history taking, my investigations, and my referrals properly, clearly. I am going to document in the bedhead ticket. So that is one medical legal management. In addition to that, if the patient says, when I am coming from the prison, there are some few scratches. People scratch me, people grab me tightly. So if he is showing you injuries, you have to document those injuries properly, right? Sometimes there are injury diagrams. When there's an injury diagram, you can uh, diagram those, you can put those injuries in that diagram, specific diagram. Some hospitals has that diagram, some hospitals doesn't have that. So when it come to there's no any diagram, you have to note down those are properly in the bed head ticket, right? So if there are injury, you are going to document those injuries properly. Then you are going to, if there are injuries, you are going to inform the police post, inform the JMO, right? So those are uh, and in whatever the referrals, investigations, and whatever the other patient related management, I'm going to document properly, clearly in the bed etiquette as it's a legal document, right? So those are the things. When if they ask describe your medical legal management precisely, those are the things you have to mention: consent, proper documentation, bed etiquette, clear monitoring, clearly documentation, then inform JMO, inform police post, and referral investigations. Whatever the things you are going to do is you are going to must document in the bed etiquette clearly, right? So that is what you are going to say when somebody asks what is your medical legal management. This should be comes in your mouth like it's a kind of reflex. You should tell suddenly, otherwise your time will be this one. Don't wait till they gonna ask questions anything other or something like that. That mean you are not up to the correct standard. So don't wait till they ask questions. You have to finish this within 1 minute everything, and you can move to the next question, right? Several politicians, because yes.
So like when it comes to noting down the injuries, do we like draw a diagram to show the site, or we just note it down the site of
It
the
depends.
injury?
It depends with there are some diagrams, and there are some in ways you are going to document it. It depends with hospital. Sometimes there are, when I worked in Anuradhapur hospital as an intern, we have to diagram. There's a diagram, and we have to document everything. This injury is this is abrasion, this is this size, and everything. That document ultimately go to the JMO's office. If the JMO can't see that, intern should go there, right? The JMO consultant asks you to come there, and what is this? So because of that fear, we are going to document abrasion. This is this size, this is fresh abrasion, everything we are documenting. It depends. Sometimes in some hospitals there are no that kind of proper diagram, but you are, what you are doing is you are drawing kind of a man kind of drawing, and you are documenting this one abrasion, this one abrasion, this is laceration. That depends with the, that is depend with the place where you are working, right? So anyway, you have to mention all those things. What are the things? Consent, bed head ticket, proper documentation, then your investigation, your referrals, your whatever the doing the clinical management, everything you are document, including date, time, place, and whatever, everything clearly in the bed etiquette. And you are going to inform if there are injuries, you are going to mention those injuries, and you are going to inform those to JMO, inform to the police post. That is for the first one, right answer. Then next one: several politicians visit the ICU and request your approval to meet the patient. Describe precisely how you are managing this situation. Chamath, you can answer. If anybody is willing to answer, you can, anyone are free to answer.
I think ICU is not a place that anyone can go and meet the patient. Uh, So
Yes, that's
unless they
good.
have special permission, yeah. But
Uh,
usually, wherever I have, like at least the hospitals I have worked, you can't enter to the ICU. Even for internal medical officers, you need special
yeah,
permission from
yeah,
senior staff.
yes. So that is like you have to that one you have to mention that several politicians, let's say a parliament member. When it come to a parliament member, you are a government officer. Parliament member is also a government officer. He is higher in the hierarchy. He is higher than you, right? There are things that we are not, sometimes we feel bad about the politicians, but when it comes to hierarchy, he is a parliamentarian. Whatever the way he comes to the parliament, he is a parliamentarian. He is in the hierarchy above than you, so you have to respectfully describe, respectfully express what is the ICU setup. This is a ICU setup. This is a closed environment. We are maintaining sterile, not sterile, we are maintaining less infections in this ICU. There's a risk of uh, when several people come to the ICU, there's a risk of getting infections to this person, including the other patients. And you can inform that when it comes to this person, as he's having, you can't directly say that he's having high blood pressure, as that is a kind of patient's autonomy, patient's privacy, that you can't say that he's having high blood pressure. But you can say at this clinical condition he need to rest. That rest itself make his condition less aggressive, as he is now having, if somebody knows that, let's say a person says he's having hypertension, I know. So when it come to, you can say that high blood pressure can itself reduce by resting. So because of that we need to rest him. And it is avoid in this place is uh, help for uh, help that you are not bringing infections to inside. And if you have anything related this, you can go and meet the director of the hospital. He's the one who is having, and my consultant, they are the people who are in charge of this. That should be comes with, you have to say politely, right? As you can't shout, you can't argue, you can chase them away. That should be come in a kind of respectful manner. Because, not because even though they are lesser in the hierarchy or whatever the hierarchy, you have to respect the people who are coming to meet that person, right? So that is how you are going to answer. They are going to get those small points, that as you are, you know, the those hierarchy, and you should respectfully tell. And you the chase away. I'm not asking them to come. So that kind of, don't give that kind of direct answers. You express yourself, and you uh, tell the examiner that I am in a position to balance these people. Rather than giving direct answers, you should balance these people, right? Okay, next one. You receive a call from a famous media corporation asking about the current condition of the patient. Describe precisely how are you going to face this situation. Right. We'll ask, Chamath, what do you think? You answer, we'll ask from another person if they are willing
Um,
to answer.
I would say I'm not in a position to divulge such information. If they want any further information, they can ask the director himself of the hospital.
Okay. Okay.
Yeah.
Okay. Anybody? Kusala Sirivardhana? Would you like to answer? If you are, do not, we are not asking you to answer.
So I don't know the answer.
Right. Anyway, don't give that answer in the exam. You at least some tell something, right? The Chamat, you gave an answer, but thing is, you have to put some icing to that answer. So start with this. There are specific words that uh, patient confidentiality, right? Patient's privacy, patient's professional secrecy. Those use those words. Then when you are using those words, they know, all right, this man has gone through the medical ethics. This man goes through the forensic ethics. So your answer is not wrong, but you should put some icing for that, right? The patient, there's a term called patient confidentiality, professional secrecy. So those are the fundamental principles of patient care, right? Information's exchange between patient and the next of kin or with doctor during a professional relationship must be kept secret, right? So add those kind of words, right? Then they know that you are uh, giving the answers with the medical ethics, right? Anybody can answer this, right? But put those specific word, patient confidentiality, patient privacy, patients. Uh, that is a fundamental of principle of patient care and the information exchange between patient, next of kin, with doctor in a doctor-patient relationship, professional relationship must be kept secret. So those things should be there, right? So when you are adding those words, they know you are dealing with medical ethics rather than lay terms, right? Okay. If anybody want to know, if any media person want to know anything, go and meet or contact the head of the institution. He is the one who is responsible for express the idea or whatever the things to the media. He is the one who is authorized, right? Even sometimes people who are in those admin field, the people who are in the head of the institutions can't give those kind of uh, patient related things, as if you know the recent incidents where some people get interdicted with those kind of things. So you have to be very careful. You can't divulge the patient's informations to a third party, right? Okay, last one. A few of your staff members, including nurses, saying to you that they are not going to treat him because he's from a corrupted political party. How we are going to manage this situation? Chamat, your answer?
I mean, as doctors, we give the Hippocratic oath, and in it says that we are supposed to treat patients regardless of their social economic standard or any affiliations. And we treat them to our best of our knowledge. So
Yes.
um, I'll tell
Yes.
the nurses like they have to treat the patient. And,
Okay.
but I'm not sure whether I'm in a position to tell that or not.
No, you can. Your supporting staff, you can. That's their right. Uh, treat or not, but it's unethical, right? What do you think, Kusala? Do you have any answer for this? Then, Tushan, I'm just asking if you are not willing to give answers. I'm not worrying about the people who are reluctant to join for the live sessions as we are asking questions. But anyway, if you don't like, I don't mind, right?
No,
Okay, let's say like this. Yes, Tushan?
no, I think the same. Like despite whether he's like, I mean, despite the nurses don't want to treat her, like we should convince the nurses to treat the patient, or despite of
Mm,
what
yeah.
the past is.
I think better not to use the convince word, right? So let's say like this. You can start like this. The basic ethics principles are autonomy, beneficence, non-maleficence, justice. What is autonomy? Patience, respect. patient's right to choose, right? What is beneficence? Do good. Non-maleficence, do no harm. Justice, treat fairly, equally, right? So when it comes to the patient, you can't discriminate. Use that word, discrimination, right? You discrimination is covered under beneficence, non-maleficence, that is avoid harm, and justice, fairly, equally. So everything covers under this word discrimination. So discrimination, what is discrimination? You can't discriminate any person socially, ethnicity, gender, religious wise, even socio-economic wise, any even politically, right? So that is unethical to treat people that will be ended up in uh, an inquiry. So because of that, you can't discriminate and you can't say that you are not going to treat him. This will ended up in as a kind of inquiry or something. Because of that, you think this is not good, this is unethical to not to treat. So that will end up as an inquiry. Because of that, you think about in that phase. So you have to add those things. You discuss those discrimination word and the autonomy, beneficence. Beneficence means do good. You always do the good towards the best interest of the patient. Maleficence means do no harm, avoid harm things, and justice means treat all the patients fairly and equally. So use those words. When you use those words, they know that you are talking as a forensic expert, not as a, you are talking as a doctor, not as a layperson, right? So always keep remember that ethics related question will be there for you. They will definitely ask kind of ethics questions, as they are the things which are used in practical forensic, right? Okay. If anybody has questions, you can ask, right? I'm going to the next question. Right. A 3-year-old child was brought to the pediatric ward by her mother, saying the child had fallen on the ground while running. Long bone X-rays were done, and these findings were there. Right? A, B, C. Can you see? I want to make it enlarge? Right. This is A. Can you see this one? Okay. Let's go to the B. They will give these kind of photos. And last time, I think this question was there. They asked about the child abuse, right? So this is there. Okay. So this is one. Right. This area. Then C. Right. Okay. Question A. Identify the above X-ray findings A, B, C. Chamat, what do you think? Or anybody willing to answer? Oh, okay.
A is a spiral fracture.
Okay. B.
B looks like dislocation of the fibula.
Okay. C.
I'm not sure. Is it the fracture of the tuberosity? I'm not sure, sir.
Okay. Anybody else willing to answer? Right. Kusala? Tushan?
Not sure, sir. A, I think it's a spiral fracture, but
Okay. B?
B and C, I'm not sure.
Okay. Right. Okay, we'll go to the X-ray findings. This is, yes, you are correct. This is a spiral fracture. Right. This one is called, what is? So spiral fracture comes with twisting force. What are the things most commonly found in the child abuse? It is twisting and pulling. So the pulling can cause bucket tunnel fractures. So this is a bucket tunnel fracture. Then again, pulling cause that if there's no bucket tunnel fracture, it can cause metaphyseal chip fracture, right? That called corner chip fracture, metaphyseal chip fracture. So this is A is a spiral fracture, B is a bucket tunnel fracture. You can just go and check in Google how the bucket tunnel fracture mechanism comes. You can easily, they will show that it comes as a, because of the pulling effect, it comes as a bucket tunnel type fracture in the growing end bones of the ends of the growing bones, right? So this is a metaphyseal chip fracture that is also called corner chip fracture, right? B, describe precisely the causation of injuries. As I mentioned, you have to mention this injury is this a kind of injury which comes with a fallen? Let's say even this child, 3 years old, so that child is walking. Let's say a child is 3 months. If this kind of injuries comes, it is highly suspicious of child abuse. It is a twisting injury, right? This pose comes with twisting. Is there this kind of pose can comes after fallen on ground? Usually you keep the hands and you get the polys fractures and the clavicle fractures and those things. Those are dislocated fractures, posterior dislocation, the dislocation. This is a you can get, sometimes it is very unlikely, but generally you don't get spiral fractures, this kind of fractures, when there's a uh, history of fallen. So this mother is saying that the child had fallen on the ground while running, right? So it is highly unlikely this kind of fracture comes with fallen, right? So you have to say the number A, it is because of the twisting, and B is because of the pulling, and the C is corner chip fracture with it is called periosteal elevation. Those are not important. So anyway, you have to mention B and C because of pulling effect, right? So you don't see those injuries, those type of force in fallen, right? So it gives the with the gravitational force and the moving force, you get kind of grace abrasions and things, and you can get posterior dislocations and kind of dislocations rather than there can be fractures, but not this kind of spiral type of fractures, right? Okay. Identify above X-ray findings and describe precisely the causation of injuries. So you have to mention A is because of twisting, B and C is because of pulling, right? Okay, this one. They will give this book and ask, briefly describe the main medical legal management steps of this child according to the content of this guideline. As let's say you are an intern in your medical ward. So in your pediatric ward, in the night, you are getting this kind of child and asking, mother is saying this kind of things, right? So what is your management according to this? You can't say, I don't know. I haven't gone through this course. This is the national guideline where you are going to be an intern in this country. So this is the national guideline of Sri Lanka. And if you are going to do AMC and you are going to the Viva, and if they ask that what is the according to their guideline, the let's say the hypoglycemia management in type 1 diabetes mellitus. You can't say I'm from Sri Lanka, I don't know the Australian guideline. As similar, you can't say I don't know this guideline. I still am not in the government setup. You can't say. You have to know. And if you go to the guideline, you know this is so. We are taken these from this guideline. Go to this guideline. You can Google this. This is there in the Google. If you simply Google this and you can find out. Go through this. There, the last page filled with these child abuse photos, right? These photos are from this guideline. Okay, what do you think, Chamal?
Unfortunately, I have to say I haven't gone through the books, but
Okay,
uh,
go
I
to the
would inform
guideline.
the
Okay,
I would inform the I would not take the proper history taking, and then
yes,
if I'm suspicious about child abuse, I would inform the police post,
okay,
and then the police post would inform the JMO, and he would take over the
okay.
proceedings.
Okay, that's fairly okay. You can survive from that because you asked the previous question. So that's why I told you all that there's a pattern of answering. If you know the pattern, you can answer well. If you don't know something, you can. As what we are doing is we are trying to make we developed 75 questions. So when somebody is going through those 75 questions, you get the pattern. So you are in a kind of reflex. You are going to give answer even though you don't know the specific answer. Sometimes you can get few marks from that, right? So this is the guideline. You all go to the guideline, go and read the guideline, even though you go through all the forensic theories and whatever the forensic ordinary books and read and go, they will give this guideline and ask. If you don't know the guideline, you don't know anything, right? So this guideline gives you the idea how to manage the child. So let's say you are an intern in your on-call night, you are getting this child. So this person, what you are going to do is you have your medical legal management. You need to get the consent. So the mother is there, the guardian is there. So I can get the consent from the guardian, the mother, right? So that is the first medical legal management, right? Then you are going to tell that I'm going to get the history from mother, right? So history from the child, and I'm going to do the relevant investigations, right? And I'm going to inform this to my seniors, my consultant, and I'm going to inform, document everything in the bed head ticket, as the bed head ticket is a proper legal document. So I'm going to clearly document everything according, including date, place, time of examination, everything, and clearly document all the things. And I'm going to refer this child to particular people who are the people in police post, JMO, and I'm going to tell the psychiatric, child adolescent psychiatry or somebody. And according to my investigations, there are fractures. So I'm going to inform this to the surgical team, to the orthopedic team. So those things, and I'm going to document those everything in my bedhead ticket, right? And according to this guideline, there's a one step called clinical case conference. That is within 24 hours, you have to do the clinical case conference. JMO should take a proper detailed history, and he is the one who is a leader in that clinical case conference, and we are discussing the further management of patient, right? After that, according to this guideline, there's another clinical case conference that is called institution case conference that will be led by the pediatrician. So the pediatric unit, there we are going to discuss with the JMO, psychiatry, the referral, other consultants, and the probation officers, and uh, police post, and the child protection authority officers. Everybody get together and discuss the future plan of this child. Can we discharge this child? Can we hand over this child to the mother? Is the home place is safer? Is there other people who are abusing this child, and you are going to is the schooling is affected? Are we going to send the child to another school? Are we going to keep the child at Mitrupiasa or Lamapisa or Child Protection Center or whatever the place? Everything discussed in that institutional case conference, and according to that, send the patient to the whatever the particular place, and we are going to review the patient clinically and legally. Right, that is the perfect answer. At least half of that, if you can tell to the examiners, they will give you full marks, because most of the people are not giving proper answers. As I mentioned, they are just going through all the ordinary forensic and get ready about the hypostasis time and the things and the decomposition times, what are the types of colors of those different type of hypostasis. You are going to the exam with those knowledge, and they are asking this kind of questions. So that is what happened basically. So that's the first day of our lecture related to this OSCE, and this is a kind of introductory lecture. Anybody has questions? Chamat?
Yes, I have a question. It's nothing related to these questions that we came across, but in a real life setting, let's say a sexually abused 15-year-old girl is present with her father, and during the history taking, you have the history taken from the parent and history taken from the child. And if the child is kind of reluctant to answer in front of the father, or the father is interfering, basically answering instead of her, how do we handle the situation? How do we separate the father? Like, we can't, can we separate the father even though because he's the legal guardian, or do we have the authority in that?
Yeah, I mean, first of all, as the child, you need a chaperone. You mentioned that we need a chaperone, and it depends with the situation. It's a kind of practical issue. So when it comes to that kind of situation, you can understand that the father sometimes he's reluctant, that he's saying that no, I'm not going to leave this place. But sometimes you have to describe and you have to discuss with him, and sometimes he's saying that okay. Sometimes those people who behave like strangers, like, so they say that okay, I'll stay there, and you do whatever, then you can keep a chaperone and you can take the history. And sometimes they are saying that I'm not going to go anywhere, you ask whatever the things in front of her. That kind of things you happen, you can uh, face both situations, right? So according to that, you have to do that history taking and the things. And when it come to intern, if they ask specifically about the interns duties, so you can say that you are going to get a brief history, and I am going to inform the JMO to get a brief detailed history and the genital examination. So don't tell that I'm going to do the genital examination. The genital examination usually done by the JMO. That is usually once or maximum 2 times. Not going to do repeatedly. And people, we are not going to ask the same scenario repeatedly. HO is asking, SHO is asking, the consultant asking, again the psychiatric people asking, JMO is asking. That is called re-traumatization. So you are not going to re-traumatization the patient by asking repeated question. That is why you are going to do the clinical case conference, where one person is getting a detailed history and express all the findings to the other staff, right? So go through the guideline. If you go through the guideline, you can get a brief idea about this. And your one is a kind of practical situation where you have to face those both situations. Either sometimes he may be reluctant, he sometimes said okay. So if he is saying that okay, I'll be there, you can get a kind of history without the father. But sometimes the father will be there. When it comes to, you just get a brief history, and you, when it comes to the intern level, you said that you are asking the JMO, refer the child to the JMO to get the detailed history, right? So that is the procedure. Okay. Any
Thank you,
questions?
sir.
Okay. Right, so that is the kind of introductory lecture for today. What we develop is we develop the 75 questions. We already uploaded those questions to the system. I think Sudhira know how to handle those things. There are no lengthy lectures. Those lectures are like this 1 hour lectures. We cover almost all the entire different type of questions which can comes to your exam. So it makes you to easier to get full marks for the 2 questions or skip questions, so that will help you to give you a advantage for when it come to the final score or kind of merit or something. You will come to the top list, top order, as you can score full marks for these 2 questions. So that is why we develop these kind of questions. We are not going to teach any those ordinary forensics because they are asking these modern practical type questions, right? Okay, anybody is having any questions, you can send a text message to our WhatsApp number. Then that is also we should mention that don't ask what are the plant poisons in Sri Lanka, that kind of questions. So we are not going to answer those questions. Those are kind of general questions. Those are separate lectures. So you have to be specifically asked questions when you are asking the one you Chamat asked, that kind of when they are asking the question, we know that this man is up to the level, or they are asking about kind of simple basic things, right? So okay, then as I mentioned last time, we had the 100% pass rate because of we give this kind of questions to our students. So if anybody willing to come to this go through these questions, you all are more than welcome for this, and it's up to you guys to decide. Okay, right, the people who are listening to our record version, the most of the people who are registered there, and they are not coming to this because we are asking questions. So don't worry, not going to harass you or not going to ask those kind of difficult questions. Okay, so they can send their questions to our WhatsApp number. Right. Okay then. Right. Good night.
Good night, sir.
Okay.
Thank you. Thank you, sir.